Hi, hello everyone. Welcome back to my YouTube channel. To all those who are new, hi, I'm Manideep, currently a second year MBBS student from Kamlin Academy of Medical Sciences and Research Center, Hyderabad. So I'm back again with another new video wherein I'm planning to start a series wherein I'll be discussing few important topics of anatomy which everyone thinks are like is difficult to understand and all, and I'll be showing major diagrams and giving few tricks so that you can follow and write in your university exams, and not only university exams of point of view, but I'll discussing major clinical aspects of all the things, so that it will aid you in clinical practicing as well. So I really hope that this video is at least gonna help a few people out there. The video, if you people like the video, I request everyone to please share it with other friends so that it will aid other people also. And if you people feel anything to include in the video and all, you are free to suggest me in the comment box. But before getting into the video, I request everyone to please share, like, and subscribe to my YouTube channel, since it takes lots of effort to shoot and upload a video. Since I'm taking a time to like a bit time from my academics and shooting videos so as to help you people. Now, without any further ado, let me just quickly go into the video.
So today in the series, first I'm going to discuss about the nerves of the upper lip. So when we see the trend in the previous question papers of the KNRUHS, that is the TS university exams, we could observe that the major LAQs are coming as nerves and arteries. Like this, for example, like in our paper, we got ulnar nerve as the question. And in previous batch, they got as brachial artery, and the previous batch, they have got the popliteal artery as the like the major essay, and this topic is very important for university exams and also for the clinical practice as well. So today I am here to discuss the few important points so as to how to present when this question comes in your university exam, and how you can score maximum in that university exam. So first, let me just classify the major nerves of the upper limb. That is the axillary nerve, the musculocutaneous nerve, the radial nerve, ulnar nerve, and the median nerve. So these are all the five major nerves that supply our upper lip. So in today's class, I'll be discussing majorly about the axillary nerve. And so the basic proforma for any nerve, like what are all the things that you have to present in your paper when a nerve comes as an essay question. That is the root value, that is from where it originates, that is from which maybe from the C2 or C3 cervical spinal nerves or thoracic nerves and all. And then the origin and course, like where it originates and through what course it goes, and it ends, like where it terminates. And then the muscles or the sensory supply, that is the motor supply it gives or the sensory supply that it gives, maybe to the muscle or the skin that it supplies. And the major relations, which is very much important, like what are all the relations, maybe the anterior, posterior, the medial, and the lateral relations that a nerve has got. And the at last the applied anatomy. So these applied anatomy is very important for any clinical practices. Like from the second year, you will be going to the clinical postings, right? So there you can probably see the cases of maybe the nerve damage or the nerve palsies and all. So first, let me discuss about the axillary nerve. So the axillary nerve is the easiest and the most shortest nerve that which supplies our upper limb. So the root values are C5 and C6. The origin and course. So the origin and course I've given you like in simpler terms. So it originates from C5 and C6 spinal segments, right? So after it originates, along with the posterior circumflex humeral artery, the posterior circumflex humeral artery, which is a branch of the axillary artery, like the third part of axillary artery. So along with the posterior humeral circumflex artery, it travels through the quadrangular space and reaches the posterior aspect of the arm. That is the posterior aspect of the surgical neck of the humerus. For remembering the spaces, like the major muscular spaces of the upper limb, here is the trick. That is, you just place like this, taking your two, like the index finger and the middle finger, upper triangular space, lower triangular space, and this is the quadrangular space. So the axillary nerve, after it originates, it passes through the quadrangular space along with the posterior circumflex humeral artery. So the quadrangular space you can also see in the picture. So this is the quadrangular space. So the boundaries of the quadrangular space, superiorly it is bounded by the teres minor muscle, inferiorly it is bounded by the teres major muscle, and on each side, that is the laterally it is bounded by the humerus, and medially it is bounded by the long head of triceps brachii. So these are all the boundaries of the quadrangular space. So I have revised you the quadrangular space as well. Here, what you'll have to remember is after it passes through the quadrangular space, it comes in relation to the posterior aspect of the surgical neck of humerus. So the humerus has got three necks, right? The anatomical neck and the surgical neck, and the base, like the neck which joins the head to the major part of the humerus. So the third neck, which is the surgical neck, so there the axillary nerve runs posteriorly to it. So I'll show you in the diagram way. So this is the head of humerus, and this is the like the anatomical neck, and this is the surgical neck of humerus. So here posteriorly the axillary nerve runs after it passes through the quadrangular space. So that is what is important. Coming to its relations, so this is the diagram which I have taken from the Vishram Singh book. So which is very simple. So I have told you, right, this is the surgical neck of humerus, and such is the axillary artery, the third part of axillary artery. So the third part of axillary artery, which gives the two like the last branches, which is the anterior circumflex humeral artery and the posterior circumflex humeral artery. Then anteriorly, anterior circumflex humeral artery, the surgical neck of humerus, and the posterior circumflex humeral artery. So when you see in the picture, we can see that anteriorly, what are all present? The surgical neck of humerus, right? I have told you it passes posteriorly. So the humerus, obviously, the surgical neck of humerus comes in anterior relation to it. So first is the surgical neck of humerus. The second is the anterior circumflex humeral artery, which is a branch of the axillary artery, and then the posterior circumflex humeral artery is also present anteriorly to the axillary nerve. That is what you have to remember. And then the posteriorly, the deltoid muscle. So the deltoid muscle is like actually covers the entire aspect of the shoulder. So not all the muscles of the deltoid, mainly the posterior fibers of the deltoid. Mainly the posterior fibers of deltoid, they come posteriorly, like they are related posteriorly to the axillary nerve. And superiorly, obviously, the teres minor muscle, which is the superior boundary of the quadrangular space. And inferiorly, the teres major muscle, which is the inferior boundary of the quadrangular space. The next, the relations and the supply. So the relations I have told you already. Now the major supply. So this is the simplest diagram, which is from Vishram Singh. We'll have to remember mainly of three things for any nerve. That is the muscular supply, the sensory supply or the cutaneous supply, and the articular supply. Motor supply in the sense, what are all the muscles it supplies, major muscles that it supplies. Then the cutaneous in the sense, aspect of the skin it supplies. With the articular branch in the sense, does it give any sort of articular branch to any joint. So the motor supply, the anterior branch, it gives motor supply to the deltoid, which you can see here also. So the posterior branch, it supplies the two muscles, that is the teres minor muscle and the deltoid muscle. So which you can also see in the picture, which is this is the anterior branch, and this is the posterior branch. This is the anterior, and this is the posterior branch. The anterior branch, it is going along the deltoid, so it supplies the deltoid, and the posterior branch, it supplies the deltoid and the teres minor muscle. Then the cutaneous branch. So the cutaneous branch, the anterior branch, it supplies the skin over the lower aspect of the deltoid. And then the posterior branch, it supplies the upper lateral cutaneous branch over the lateral half of the deltoid. So the posterior branch, it gives supply to the lateral aspect of the arm. And then the lower lateral aspect of the arm, the cutaneous supply is given by the anterior branch. The posterior branch, it supplies the lateral aspect of the arm, that is over the deltoid, and then the anterior branch, it gives the cutaneous supply to the lower lateral aspect over the deltoid, like the lower lateral aspect of the deltoid or the arm. And then the articular branch, it gives an articular branch to shoulder joint. And then the applied anatomy, which is very much important for clinical practice. We generally give an intramuscular injection. Intramuscular injection is given to the bulk of muscle. So like how to elicit the bulk of the muscle is, we'll take two hands and pinch over the muscle, so that we'll be palpating the bulk of muscle. So when we consider this to be the deltoid muscle, this part is the bulk of muscle, and the axillary nerve, it runs a bit it runs a bit superiorly. In the process of giving the intramuscular injection, if at all a clinician injects at the wrong side, that is superiorly to the bulk of muscle, then there is a high chance of the nerve getting damaged. So when these nerve gets damaged, the major motor supply to the deltoid muscle is given by the axillary nerve. So when the nerve gets damaged, the deltoid muscle gets damaged, so there is muscle wasting of the deltoid is seen. So the major function of deltoid is lost, which is the abduction greater than 15 degrees is lost of the shoulder joint. So that is what is important.